Good morning, all. It is very difficult to convince actually to people to go for the trifocals, but I have no financial interest, and whatever I will be speaking on my personal opinion, backed by literature and personal experiences. So today's scenario, there are the use of mobile or smartphone. The 84% of people are using mobile and smartphone, 70% own a computer, and 57% use a tablet on a regular basis. It's a study of 55 to 64 years old people, and it is very difficult to argue and convince, but I will try to justify my statement. The various presentation of miliary cataract, as Dr. Nitin has already spoken, it is associated cataract in congenital syndrome, secondary cataract, traumatic cataract, posterior subcapsular cataract, pediatric cataract, idiopathic cataracts. The unilateral cataract, there are different causative factors. It is asymptomatic aging, glaucoma or uveitis. Rate of progression may be different in prolonged exposure or ultraviolet radiation from sun or smoking. Corticosteroid, diabetes, trauma, usually younger patients, more adaptable, and more than 50 years of age, a second eye to be done at an earliest. These are the various presentation of the unilateral cataracts. So each and every patient asks for spectacle independence. They got a common question, and where he has to use lenses and spectacles after the operations. That is a very beautiful study in the literature I found. It says unilateral implantation of trifocal IOL is well tolerated with good patient satisfaction assessed by visual function. 14 questionnaire in subjects to have cataract in one eye, encouraging single eye surgical procedure in this particular group of patients. The one more study, it says this meta-analysis of 13 unique clinical studies demonstrated that at least 9 out of 10 patients receiving trifocal IOL during the cataract surgery can expect to achieve complete spectacle independence. So the congenital cataract, exclusions in this group is associated with glaucoma, retinal pathologies, and systemic problems. Trifocal IOL implantation should be considered as an alternative to monofocal lenses in selective cases of pediatric cataract also, where amblyopia is not expected. So there is one more study, it is found in the literature in case of pediatric cataract. In careful selected pediatric patients with traumatic cataracts, trifocal toric intraocular lenses may offer some benefit over the standard monofocal lenses, it says. This is a study of visual performance in monofocal, accommodating, and multifocal intraocular lenses in patients. These are the different lenses which I use in this study. And there is 87 patients of around age of 40 to 70. It concludes that multifocal IOLs provide better stereopsis, higher spectacle independence rates, and satisfactory functional vision over a broad range of distance in presbyopic patients with unilateral cataract compared with the monofocal and accommodating IOLs. So I'll skip this slide. So there are the recent technology and the advanced technology shows that trifocal IOL, it is tri with EDOF, had higher balance contrast in comparison to the traditional trifocal. The MTF peaks are almost equal in 3 different foci. So the new generation IOLs of trifocals with which is EDOF with tri, they are super Gaussian profiles, and this gives minimum glare and halos. So light distributions is, you can see the hybrid technology of EDOF with tri or multi is there's a continuous vision across the entire range. So in conclusion, so these are the different light sources. If we see the violet filtering added to the lenses now blocking the high energy violet wavelength improves the driving vision quality and reduces the scatter. The people side independence of IOL contributes to the best low light performance compared to the leading trifocal IOLs in the new group of trifocal patients. These are high myopic patients has gone for the trifocal IOL and S6, N6 which I have got. In conclusion, consideration is operating the other eye at earliest is, if possible, patient wanting for the refractive lens exchange. Light adjustable lenses and spiral lenses also come into the market to minimize the dysphotopsia. Unilateral implantation of the trifocal IOL in patients with unilateral cataract could provide good distance, intermediate and near vision with good patient satisfaction and vision related daily activity performance regardless to the presbyopic status of the fellow eye. So treat the patient as for the requirement, should not be a biased decision and follow blindly. Patients should be provided with what is the best in today's scenario. Quality should score over the quantity of the surgery. Decisions should be backed by proper evidences, and for spectacle independence, trifocal IOL is a very good option. So we have best skill, best technology, best setup, best machine, best options of IOL, high expectation of the patient, so why to compromise? So you have to choose which one you going for the newer era. Thank you very much.